Hello guys, so I'm back with the paper 4 specimen paper for A2 psychology. Think of this as a continuation of the last video where I discussed the format for paper 3, what is expected, um, a little bit of a guide on how to answer questions. So I'm going to discuss the paper 4 specimen paper now. This is referred to as your paper 4 application and research methods paper. Okay. And just like your paper 3, this is also for an hour, 30 minutes, and a total of 60 marks. Okay, so there are a few instructions over here which we need to keep in mind when answering the questions. Now, just like I told you in paper 3, when you open your paper, the question paper, you will see all 4 components, all 4 modules, all 4 options in the paper, which means you will have a section with questions on clinical psychology, on organizational psychology, on consumer psychology, and on health psychology. And you would naturally attempt questions for the 2 options that you have studied for, which you also attempted in paper 3, right? However, the difference between paper 3 and paper 4 is in paper 4, you will have a choice in section B. So the paper is split into 2 sections, section A and section B. Now, let's say you are attempting health and clinical psychology. You will have to attempt every question on health and every question on clinical psychology from section A. So you don't have a choice in section A. In section B, however, you have a choice. In section B, you need to choose whether you want to attempt the question for clinical psychology or whether you want to attempt the question for health psychology, assuming these are the 2 options that you have studied for. Okay, obviously, if it's consumer and organization, let's say, for example, then you would select whether you want to do a question on consumer or on on organizational for section B. So in section B, you just need to attempt one of the 4 options that you have, one of the 4 modules, right? But in section A, you have to attempt 2 that you studied for. Now we'll take a look at the breakup of these questions, how many marks they're for, and I'll also explain to you how this is different from the previous paper 4 from the old syllabus, the old format. So section A, as you can see, the instructions are very clear. Answer questions from 2 options in this section. Let's assume we are attempting clinical psychology and health psychology. So for section A, as you can see, we have 2 questions on clinical psychology. Just like this, you will have 2 questions on health psychology as well. Okay. We need to attempt both of these clinical psychology questions and we need to attempt both of the health psychology questions. There is no choice over here. It's not like you need to attempt either question 1 or 2. You need to attempt both. And it's not like you have to attempt either clinical psychology or health psychology in section A. You need to attempt both the modules, both the sections. So that basically means for section A, you will be attempting 2 questions for clinical and 2 questions for health, which in total means you're attempting 4 questions in section A. And if you look up at the instructions, you will see over here, it clearly mentions answer questions from 2 options. Section A, answer 4 questions. So this is why it says 4. 2 from clinical and 2 from health, assuming those are the modules that we are attempting. Now, how many marks are these 2 questions for? How many marks is section A for? So as you can see, question 1 has 3 parts to it. Part A, part B, and part C. Part A is for 4 marks. It can be split into part A1 and part A2. Question 1B is for 2 marks, and question 1C is for 4 marks as well. So question 1 will be for a total of 10 marks. And question 2 will be a total of 8 marks. So clinical psychology for section A is going to be 18 marks. Similarly, health psychology for section A is also going to be for 18 marks, split into 2 types of questions. Question 1 will be split into parts A, B, and C for 10 marks. Let's take a look if that is the case. As you can see, health psychology, there are again 3 parts A, B, and C, 4, 2, and 4. So 10 marks for the first question and 8 marks for the second. So a total of 18 here as well. So 18 for health, 18 for clinical. That's a total of 36 marks split into 4 questions for section A. That leaves us with a total of 24 marks left in the paper for section B. And these total 24 marks will be for one section only, okay? So 24 marks for either clinical or 24 marks for either health, whichever question you feel is easier, you know more of, you can attempt the 24 marks in section B for that particular module. So we'll look at section B in a bit. Let's first focus on section A again. Now, what sort of questions will come in section A? Let's focus on question number 1. Now, the first thing I want to point out is I mentioned this really key bit of information, which not a lot of people are aware of in the paper 3 guide that I posted in the last video, that questions that come on topics or on chapters in paper 3 will not be repeated in paper 4, okay? So for example, if in paper 3, the chapters that you were asked questions on were OCD, ICD, and mood, you will not expect any questions on OCD, ICD, or mood in paper 4. So from what I remember in specimen paper 3, there were questions on mood disorders, on ICD and OCD, which means in paper 4, you can expect questions only and only on the remaining 2 chapters, which are anxiety and schizophrenia. So let's see if that is the case. Question 1 is a question on, as you can see, Freeman, which is a key study from schizophrenia. So yes, we do have a study on schizophrenia. And that means question 2 should be on the last remaining chapter from the 5, which is anxiety disorders. Is that the case? As you can see, question 2 is on anxiety disorders. So same with health. Okay, so if you look at the health component, the topics which came in paper 3 for the specimen paper were patient-practitioner relationship, stress, and health promotion. So you cannot expect questions on any of these 3 chapters in paper 4. So the only 2 remaining chapters in paper 4 for health psychology that could potentially come are adherence and pain. And is that the case over here? As you can see, question number 5 is on adherence and question number 6 is on pain. So yes, you can do a bit of selective studying for paper 4. Now, is this 100% going to be the case? Well, it should be, that the chapters which come in paper 3 should not be repeated in paper 4. Because, so I'll tell you one thing about the previous format. So 2018 past papers up to 2023, split into 3 months, the Feb-March series, the May-June series, and the October-November series. And there are 3 zones, right? So for March, you've just got 1 paper. For May, June, you've got 3 papers, okay? 3 paper 3s and 3 paper 4s, depending on whichever zone you're taking the exam in. Same with October, November. So if you've got 1 exam, 1P3, 1P4 for March, 3 P3s, 3 P4s for May, June, and 3 P3s and 3 P4s for October, November. That's a total of around 7 P3s and 7 P4s for the whole year. For 2018, then the same for 2019, all the way up to 2023. I actually sat and I took a look at each and every single past paper for each year, for each month. And I just compared if there was even a single case where if a particular chapter came in P3, if it were to be repeated as a question in P4. And not once was this the case, right? All the way from 2018 to 2023, in none of the months, none of the years did a single paper 4 include a question on a chapter that was already asked in paper 3. So I wanted to see if this would be continued in the new exam format, which is from 2024 onwards. Now, based on the specimen paper, it shows that the questions, the chapters which come in paper 3 will not be repeated in paper 4. But this is just a specimen paper. Will this be the case in the actual exam? Well, because we don't have past papers for the new format, the only exam that we do have is the recent Feb series that just took place last month. So I managed to get a hold of the paper 3 and paper 4 for the Feb exam, which is technically the only past paper we have for the new exam format 2024. And the same structure was followed in that as well. chapters which you were tested on in paper 3 were not repeated in paper 4. So judging by that, for the upcoming May-June series, try to remember which chapters came in paper 3, and 99.9% surety I can give you that those chapters will not come in paper 4. However, if you're still unsure, you can still just maybe go over the chapters, all 5 chapters, just in case. It might be useful to know details of other chapters. You never know where you could actually give reference to other chapters in some of your answers. So why not just revise them just in case? You can never really trust Cambridge either. So there's always that 1% of doubt which you should leave. However, 99% you can be confident that any chapter which is come in paper 3 is probably not going to be repeated in paper 4 if they're true to their word. Okay, so now let's take a look at what type of questions you can expect. Now, the one piece of advice I will give you for paper 4 is brush up on your research methodology. Okay, AS research methods, you probably think it's not important anymore now that you're in A2. It's extremely important, right? Majority of the questions in paper 4 will be on research method related questions relating to the chapters, relating to the topics in each particular component or module that you're studying. So what are you required to know for your research methods for A2? So I would highly recommend that you focus a bit on the sampling techniques, their strengths and weaknesses, the experimental designs and the strengths and weaknesses. You may remember those one-tail, two-tail hypothesis in AS. Brush up on that. Brush up on the different research method techniques, field experiments, self-report, observation, lab experiment, longitudinal studies, case studies, correlations. Read over the definitions of each, the different types of each, and the strengths and weaknesses of each, because there is a design study element in paper 4, and you would need to know each of these different research method techniques in order to design your study. And they could just ask you about these in general as well in section A. So relating to a study. So you should brush up on these points and go over the ethics, go over validity, reliability, generalizability, ecological validity, these terms that you should know. You should know for paper 3 as well, because you have to write evaluations in paper 3. So you should know these terms as it is, but you should perhaps be able to link it to studies in paper 4 as well. So let's look at some of the questions now. Answer all questions if you have studied this option. Okay. Question number 1. Yes, one more point I want to tell you. Focus on the key studies for paper 4. You should know all the topics for the 2 chapters that will come, but question 1 will almost definitely be basing it again on the specimen paper and the only past paper we have for the Feb series. Question 1 of all 4 components. Okay, the first question in section A of any of the 4 components will always be on a key study. So as you can see over here, from the key study by Freeman, okay, consumer, from the key study by Robson. Let's take a look at health. It will be a key study. From the key study by Yockley and Glenwick, and lastly, organization from the key study by Giacolone and Rosenfeld, right? So you should really focus on the key studies. There is one key study in every chapter. So make sure you know the details of those key studies. Make sure you know the research methodology of those key studies. So let's take a look at the type of research method related questions that they could ask you on these key studies. So the question says, from the key study by Freeman on virtual reality and persecutory ideation, explain the sampling technique that was used to recruit the participants. As you can see, a research method related question on this topic, sampling technique, right? It's not going to ask you necessarily too many questions on the procedure. Focus is going to be slightly more on the research methodology, right? The research method terms used and the research methodology used in the study, in the experiment. So that is something that you really need to focus on. That doesn't mean that they can't ask you on the procedure, they can, but again, focus should be a bit more on research methodology. So explain the sampling technique that was used to recruit the participants. It's for 2 marks. So if you just state the sampling technique, which is volunteer sample, you will only get 1 out of 2. Talk about how it is a volunteer sample. The participants responded to an ad and as a result selected themselves to take part in the experiment. Explain one reason why Freeman did not use participants with a history of mental illness. So another question on the sample. We know that it was a non-clinical population, a non-clinical group of participants, which means that they did not have any disorder, any mental disorder, right? So why would they use participants in such a study when they don't have any history of mental illnesses? And the reason for that is perhaps because it was a pilot study to see if the nature of the study would actually work so that we can maybe replicate it in future on actual participants with medical disorders. People without medical disorders may be able to answer in a more truthful and valid manner as opposed to someone with schizophrenia, for example. So, some common sense points about the sample which you should know. Now, these are not necessarily points which you will find in or answers that you will find in your studies while studying them in your textbook while studying these chapters. You may have to use your brain a little bit and think a little practically. Okay, for example, this question right here. Suggest how one sampling technique could have been used to recruit participants for this study other than the technique used by Freeman. So they're still testing your knowledge of sampling techniques. So if this used for volunteer, you can mention any other sampling technique. Okay, you can mention opportunity, random. You can even mention the sampling techniques that most of you studied in sociology, such as snowball, stratified sampling, if you want, right? You don't have to use those. You can stick to the ones we've covered in AS psychology, which are random and opportunity and volunteer. But if you are aware of other research of other sampling methods which you think are applicable, you can definitely use those and explain how it would be used in this study, right? For example, if you use an opportunity sample, you could say that you could do a study on the students who are readily available at the university, okay? Explain one strength and one weakness of using students as participants in research method using VR. So question 1 is focusing a lot on the sample of the study and questions relating to the sample. So what is the strength of using students? Here's another question where you can use some research method terms and a little bit of practical common sense will also come into play. A strength of using students in the study is because keep in mind this is a study using virtual reality, right? Students in the study are, well, the average age was around 26 years because it also had some people from the staff, but students are commonly, university students are commonly aged around 21, 22. These are students who have some prior experience with video games. They probably used VR headgears before. So there's a bit of familiarity with the process of virtual reality. So because of that, it might be more familiar to them. It might be easier for them to use. So for practical purposes, it may make sense for them to use students. So that could be the strength. Weakness, however, it could be that students using only students means it's not generalizable to older people or to younger people who may not be as familiar with the process of VR, right? So that could lower the validity because they're someone, let's say, for example, someone who's 50 or 60 years old who's never used a VR headgear. For them, it might be a very uncomfortable, unpleasant situation, a very uneasy, confusing situation, which could act as a confounding variable, which may lower the results of validity of the results of the study. Right? So you have to be a little smart about how you answer such questions and try to use research method terminology wherever applicable. Now let's take a look at question 2 of this section. So the first one was on schizophrenia. The second one is on anxiety. Let's see what it says. So case studies are often used to study fear-related disorders such as phobias. So they're talking about the case study research method technique. Now, the question doesn't always have to be about research methodology in paper 4. It says application and research method. So you should be able to apply your knowledge of the content as well. As you can see, question 2A is not a research method question, but in fact, it's asking your knowledge about the content. Outline the psychodynamic explanation of phobias. Okay, so the psychodynamic explanation by Freud, it's not a 4-mark or a 6-mark or an 8-marker, so you don't need to give a lot of detail. Just very briefly give a short definition or explanation of what the psychodynamic explanation of phobias is for 2 marks. Okay, you can talk about how it's a conflict between the id and the superego, And you can talk about the theory by Freud very briefly, and you can say that although the id and superego are parts of the mind that exist in everyone according to Freud, the way that we generalize our fear onto different objects or different people, different events, is explaining how the phobia can develop, right? Now, for part B, suggest how the psychodynamic explanation can explain why individuals differ in their development of phobias. So again, applying your knowledge of the content. So again, not necessarily a research method related question, more of a content based question. Now, the knowledge that you have of the psychodynamic explanation, how can it explain why individuals differ in their development of phobias? So although everyone has the same aspects in their mind of the id, ego, superego, according to Freud, as I said, the way that we are able to generalize the fear that we have onto different people, different objects may differ from person to person. One person may transfer this fear onto, let's say, for example, a horse, like the study by Freud on Little Hans, whereas someone else might not have transferred the phobia onto a horse. They might have transferred it onto something else, which might explain why someone else might develop a phobia of another object or another animal as opposed to a horse. Right, so just a quick explanation of how it can be explaining why different individuals can develop different types of phobias. Explain one strength and one weakness of using case studies. So going back to a bit of research methods. So you should know your strengths and weaknesses of the case study method in relation to studying phobias, right? So if you're aware of the strengths and weaknesses, you would remember that case studies allow for a lot of detailed, qualitative, in-depth data to be collected over time by using techniques such as interviews, questionnaires, observations. So you can get a lot of detailed data to understand not only the origin of the phobia, to understand how it started, but also how it might be developing over time. The weakness would be that case studies are usually done on just one participant, and therefore it may lack generalizability. And you can give the example of how it was done on just one participant named Little Hans. So that would naturally lower the generalizability. Okay, so these are the two questions or the type of questions that you can expect in section A. Let's briefly go over the two questions for health. Again, a question on the key study by Yockley and Glenwick from adherence. Outline the two experimental conditions. So now they're talking about the experimental and control conditions over here, which is again also a research method concept that you're supposed to know really well. So two experimental conditions, we know the reason this is 4 marks is because you have to not only state them, but briefly describe them. There were 4 in total. You can mention any two: the general prompt group, the specific prompt, the increased access, and the last one was the monetary incentive. So 1 mark for mentioning, 1 mark for just briefly describing the group. Suggest why Yockley and Glenwick included 2 control conditions in their study. So you can talk about the purpose of having a control group. It acts as a baseline for us to compare the results to compare the results of the experimental group with, to see if there is any change. It's because of the IV, which obviously adds to the validity. And then you can even mention the specific control groups that we used in the study. There was a telephone contact group, and then there was a no contact control group. 2 weaknesses of conducting field experiments, right? So again, research methodology, you should know your weaknesses of a field experiment in relation to this study. So, field experiments, more difficult to control variables compared to a lab, which can lower validity. Give an example related to the study. Participants may not be aware that they're part of a study, which could obviously be unethical. And at the same time, if you're not aware, if you haven't volunteered for a study, then in that case, we might not be as motivated to participate actively in the study either, which could affect the results. For example, in this study, some participants, some families refuse to take part in the study actively. So, refuse to maybe get their children immunized because they were not as motivated. So you can just give a point with regards to that. Question number 6, this should be on pain. It is: the UAB pain behavior scale can be used with patients in a hospital. It uses repeated observations to measure changing levels of pain. Describe how the scale is used with the patient. So this is a scale that was used. Just to briefly describe for 2 marks how it was used, where the observer or the nurse would record the behaviors, 10 different possible behaviors relating to pain of the patient. and they would give them a score of either 1 or half or 0, depending on the frequency of that particular behavior. And then they would record this every day to see if there's any change over time. Suggest why it is important to use repeated observations to measure changing levels of pain. So again, this is more of a question where you have to use your you have to be a little practical, use your common sense. Using a repeated observation would mean that you can track the pain behavior over time, over a number of days, to see if the pain is increasing or reducing, and you can give the treatment medication accordingly based on whether the individual's pain is increasing or not. Explain one strength and one weakness of using the scale. So again, strength and weakness of using a particular scale, a questionnaire or a pain behavioral scale or a UAB observational scale such as this. So going back to some points about research methods, right? So it's standardized, it can be replicated. It might provide quantitative data, which could be used to compare results over time, give you an objective measure of the person's pain. Weakness could be a validity-related issue because it's the nurse or the doctor who is observing the patient's pain and recording it according to their own perception, their own subjectivity, whereas the patient themselves are perhaps the best judge of their pain. So someone else observing you and rating their pain might not be as accurate as if you yourself were to be the one to rate and judge your own pain, which would lower the validity. So these are the type of questions that you can expect for section A, and you have to attempt all of this. Let's move on to section B. Section B, it says over here very clearly, answer one question from this section. So you need to pick either this question for clinical or the question for health. So just spend some time and take a look at the two questions and see which one you feel you are better prepared for, which one you know more of, and whichever one you find easier. So this is a design study, right? Similar to the design question plan, the study question that you had in paper 2 for AS psychology. So not only should you focus on the content, because that is important. If you're not familiar with the content, if you haven't revised it well enough, if you haven't studied it well enough, then you will struggle to write a good study. Other than the content, you should also focus on the type of study they're asking you to design. So if they're saying design an experiment, whereas in the other module, they're asking to design, let's say, specifically a structured interview, and you feel you're better at designing experiments than interview-based studies, then you might want to opt for the experiment design study. So these are just some points which you can keep in mind. As you can see, it's got 3 parts, A, B, and C. Part A will always be for 10 marks, okay? The major chunk of the marks will be for part A. This is the part where you're actually planning your study. This is the part where you're designing your study. Part B is for 8 marks. It's split into part B1 and B2. And part C is for 6 marks, which is also split into 3 parts, C1, C2, and C3. Now let's take a look at the question. Schizophrenia can be treated, yes, one more thing. Now, there are 2 chapters which will come, as I discussed earlier, for each module in paper 4. One of those 2 chapters will be repeated. So as you can see, schizophrenia is being repeated. It was in section A and it is also in section B. And that means that for health, one of the topics which came in section A, which was adherence and pain, one of those will be repeated. And it says over here, plan a study using an interview to investigate age differences in rational non-adherence. So the topic of adherence is being repeated. So one of the 2 topics coming in paper 4 will be repeated in section B. Okay, the chapter will be repeated, not necessarily that same section of that chapter. Schizophrenia can be treated biochemically with drugs such as antipsychotics, but they are not always effective. Okay, so this is about the treatment topic from the chapter of schizophrenia, specifically the biological treatment, the biochemical treatment of antipsychotics. It's saying that you can treat drugs with antipsychotic, you can treat symptoms of schizophrenia biochemically with antipsychotic drugs, but they are not always effective. Plan an experiment to investigate the effectiveness of antipsychotic drugs to treat schizophrenia. Key points over here. Plan an experiment. They've told you what type of study they want you to conduct. They're saying an experiment, but they haven't described what type of experiment, natural, field, or lab. So you have the choice to choose whichever one you want. Obviously, you would pick the one that is appropriate to this study, right? field experiment, for example, which could be done at an actual clinic, right? So that would make sense. They've told you what is being investigated, the effectiveness of antipsychotic drugs to treat schizophrenia. Now, something that they've added over here, which was not the case in AS, is they're telling you specific details that must be included in your answer. Your plan must include details about a sampling technique and a directional or non-directional hypothesis. So these are 2 points that you have to include. And these aren't 2 fixed points that will always be coming for the design study. It could be different. They could ask you, they could say your plan must include details about an experimental design. If it's, let's say, an interview-based study, they could say must include details about the type of interview. If it's an observational study, they could say must include details about the type of observation. So it really depends on the question, okay? Over here, the details must be about the sampling technique, and it must include a directional or non-directional hypothesis. So if you don't include these points, you will lose out on marks. So I will discuss how to design a study in another video, but you should keep in mind all those points that you would use for a design study, the who, what, where, when, and how that we learned in AS. It would be pretty much the same format that you use in AS for A2. Only difference is you can include, like it says over here, directional, non-directional hypothesis, talk a little bit in detail about how you're collecting the sample, who the sample is. For example, if it's a volunteer sample, how is it a volunteer? Placing an ad, how are you placing the ad, and details of it as well. And naturally, if it's an experiment, you can talk about like the IV. Let's say, for example, one group is getting the antipsychotic drugs, the other is getting a placebo, so there'd be a control group. You can say it's an independent measure design, talk about controls, talk about some ethical guidelines, talk about how you're measuring the symptoms over time, which would be the DV. So all of those details, which you normally would put in a 10-mark design study experiment, you would include. Now, part B is asking for one piece of psychological knowledge on which your plan is based. This means that any design study that they're going to give you, any plan, study, plan, and experiment question that they may give you in section B for paper 4 will always be based on a topic from your syllabus. And that topic is the psychological knowledge. So the psychological knowledge that our study is based on is which topic? The biochemical treatment of schizophrenia, right? So you should be able to immediately figure out which chapter, which section, which topic, which study this design study is based off from our syllabus. So this is the biochemical, specifically the antipsychotic drug treatment of schizophrenia. Describe that psychological knowledge. So briefly, for 4 marks, explain that particular topic from the syllabus. Talk about antipsychotic drugs, first generation, second generation. Talk about how they work, talk about what they are, and give a few examples. So you're basically just describing that part of the syllabus that our study is based on, right, for 4 marks. B part 2 is explain how you use 2 features of the psychological knowledge to plan your experiment. So in part B1, we're just briefly describing that particular topic, which is in the syllabus that our study is based on. In part B2, we're actually going to pinpoint 2 specific features of that topic that we are incorporating in our answer. For example, we described first and second generation antipsychotics in B part 1. In B part 2, we can say that one feature that we used was we compared antipsychotic drugs, second generation antipsychotic drugs, to placebos, right? Because that is something that was done in the study. Specifically, the second generation antipsychotic drugs were used, perhaps because they have fewer side effects than first generation antipsychotics. Second feature could be that we use, let's say, a randomized, double-blind randomized control trial, where participants were randomly allocated to either the experimental condition or the placebo condition. And it was a double-blind technique where neither participants nor researchers were aware of which group the participant was in. This was something that was discussed in the chapter as well. So that is a particular feature which you've incorporated in your answer as well. So that is something that you would be required to do for B part 2, right? And finally, question number C, just some research method related questions about your study. And it'll be based on these 2 points, the 2 points that your plan must include details about. State 2 reasons for your choice of sampling technique. So you went for, let's say, a volunteer sample. Why did you go for a volunteer sample? Don't give it strengths, because you have to save the strengths for C part 2. As you can see, explain one strength. So reasons for including a particular sampling technique and the strength of that sampling technique is not the same thing. Reasons could be, you could say that one reason I went for volunteers because perhaps if you compare it to opportunity might not have made sense for you for whatever reason. You can, depending on the procedure, depending on the nature of your study, maybe opportunity would not have made sense because participants might not have been readily available. So we would need participants to be, recruited. Um, you went for perhaps a volunteer sample because you wanted participants to maybe it was in a situation where people would read, let's say, an ad in the newspaper or social media. So you decided that it would be convenient for them to respond to an ad and show up. So whatever reason you believe made sense to you for choosing a particular sampling technique, you could include that in C part 1. For C part 2, you have to give a strength of that sampling technique. So this is your research method knowledge of that particular sampling technique. So for example, a volunteer sample technique, the strength is that participants might be more motivated. You can control the specific features of your participants. So, if you want only males or people of a particular age, you can do so through volunteer sample. If you went for opportunity sample, you could say that it's more convenient, less time consuming, a large sample, which might be generalizable in a very short time period. Just the general strengths and weaknesses of a sampling technique. And lastly, explain one reason for your choice of a directional or non-directional hypothesis. Now, you're not required to write a null hypothesis. It's up to you. In your answer, you can incorporate either a directional or a non-directional hypothesis. So a directional hypothesis, for example, would be participants given the antipsychotic drugs would have a greater improvement in their symptoms compared to those in the control condition who were given a placebo. Right? This would be a directional hypothesis. A non-directional, if you chose to write a non-directional hypothesis, you would say there will be a difference in the improvement of symptoms of schizophrenia, depending on whether participants are in the antipsychotic condition or the control condition, right? So for C part 3, you would give your reason for choosing, let's say you went for a directional hypothesis. You would say the reason I went for directional hypothesis is because we wanted to give the results a particular direction, as we believe that the antipsychotic drugs will have a greater impact on reducing symptoms than the control group. If you want to say that, if you went for a non-directional hypothesis, the justification could be that because we were not giving any specific direction to the result of our study, as we're unsure of whether one would have more of an impact on the other. Right, so you're just explaining your reason for this. Let's briefly go over the design study for health as well. So as you can see over here, they've asked you to, give me a second. Okay, so just trying to remove this. Anyways, let it be. So we are looking at health psychology. Plan a study using an interview to investigate age differences in rational non-adherence to medical requests. And it says that your plan must include details of a sampling technique and an interview technique. So the previous one included sampling technique and a directional, non-directional hypothesis. Over here, it's saying interview and sampling technique. And the rest of the questions are the same. Psychological knowledge, 2 features of psychological knowledge, 2 reasons for your choice of sampling technique, 1 strength of your choice of sampling technique, 1 reason for your choice of interview. So pretty much everything that we discussed for the clinical topic, you would apply the same concepts for health as well. If you chose to do health, whichever one you found easier, you would attempt that in your answer for section B. Now, I just want to briefly explain to you how this is different from the old format for paper 4. Previously in paper 4, let me use the whiteboard to explain that. Previously in paper 4, it would be for 1 hour, 30 minutes, just like this, 60 marks. So the time and number of marks is the same, but there were 3 sections. Okay, there was a section A, And in section A was basically for 30 marks, where let's say if you're attempting health and you're attempting clinical, there would be a 2 marker, a 4 marker, another 4 marker, and a 5 marker for health, 2, 4, 5 marker for clinical. So 15 marks for clinical, 15 marks for health. And you would have to attempt both. This would be for 30 marks. Then you have section B. Section B would be for 18 marks. And over here, you would have a choice between health or between clinical, if these are the two that you're attempting. And this would be a design study question, just like the one we just saw in section B for the new format. So part A would be for 10 marks and part B would be for 8 marks. Now we saw the question for part B, it was split into part B1 and part B2 for 4 and 4. Previously, it used to be one fixed 8 marker where it would ask you to describe the psychological and methodological knowledge which your study is based on. They no longer ask you the methodological knowledge, they only ask you the psychological knowledge, and they break it up into 2 parts. Describe the psychological knowledge for 4 marks and 2 reasons for the psychological knowledge that you chose. Okay, so for those of you going over the past papers who've come across this part B question in the design study, this is why it's recommended not to really do a lot of past papers from the old syllabus, because this format is no longer applicable. You can practice the design questions for part A, but for the rest of the design question like part B, you should not practice that. Instead, you can try and attempt the design question based on the new format. Same for clinical, 10 and 8, and you can decide whichever one you wanted to do, 18 marks for health or 18 marks for clinical. And the biggest changes, there was a section C for 12 marks with just 1 question on health and just 1 question on clinical. And again, you had a choice of whichever one you wanted to do. And this 1 question would be a total of 12 marks. So imagine having to write a 10 marker, an 8 marker, a couple of 2, 4, 4, and 5 markers, and then to end it all off, a long 12-mark debate question as well, which would maybe take up to 3 to 5 pages. So a lot of writing was involved in this previous format. They've entirely removed this section C. There is no longer a 12 marker, which is good, because it was almost impossible for students to complete the paper 4, which is why perhaps the threshold was very low. In some papers, an A was as low as 29 out of 60 in paper 4, because students struggle to finish the paper. They struggle to write top band answers for these questions. So if anything, your paper is a lot easier now in terms of the new format. So if anyone has any questions about the paper 3 or paper 4 format in the 2 videos that I've just uploaded, feel free to reach out to me. My details, as always, are mentioned in the description below. And I will hopefully return soon with a video explaining how to evaluate topics, the evaluation 10 marker for paper 3, as well as how to design a study in paper 4. So take care of yourselves and see you guys next time. Bye-bye.